Let's discuss medical decision-making for transitional care management services. For a patient recently discharged from the hospital, first you would document the status of all chronic stable conditions that you would be treating, evaluating, assessing, and monitoring. Think TEAM, team. Determine if TCM is medically necessary. Consider if the patient was hospitalized for a problem that is new to you as an examiner, or is an established problem. A new problem is likely to have more management options for you to consider. If the patient was hospitalized for a problem which is new to you, but has resolved or significantly improved, you would have fewer management options. This would also decrease the medical necessity of a higher level of medical decision-making. If the patient was hospitalized for a problem that is an established problem to you, however, it was exacerbated when the patient was hospitalized, you will need to determine the current status of the problem. Has the problem incrementally improved? Resolved altogether? Or is it still progressively worsening? To the extent that you need to consider other management options? Problems that are worsening support a higher level of medical necessity, whereas problems that are resolved may not qualify for a TCM service, as they may not met the medical decision-making and medical necessity criteria. Medical decision-making for TCM services must include 2 out of the 3 following components: multiple diagnosis and management options, complexity of data to be reviewed, risk of complications, morbidity or mortality, as well as comorbid conditions. Multiple diagnosis and management options can consist of status of chronic stable conditions, or an established problem that is worsening, and the status of 1 or 2 stable conditions, or a new problem with or without a planned workup. If you document you reviewed or ordered lab tests, radiology tests, or other testing from the medicine section of CPT, such as an EKG. In addition, it may include a review or summary of old records, and an independent review of an image or tracing. That also can increase the complexity of information you need to process, to make your decision. The last element to consider is the risk of complications, morbidity or mortality, as well as comorbid conditions, and can include a home care aid to manage blood pressure. A patient's chronic condition is stable or has a mild exacerbation. Prescription drug management, with a documentation of active management of the medications. Sicker patients may have higher levels of risk to consider. A complex cancer patient with life-threatening illness. A patient recovering from a stroke, MI or PE. An illness which is unstable, constant or deteriorating. This would support a medical necessity for TCM services. Finally, you need to consider if 2 of the 3 elements meet or exceed a moderate level of medical decision-making. Patients whose conditions do not necessitate moderate or high MDM do not qualify for TCM service. If you document that only 1 element meets a moderate level, and the other are low or straightforward, utilize an evaluation and management code, and not a TCM code. However, if documentation supports that 2 of the 3 elements met a moderate level of medical decision-making, then code 99495 would be appropriate to bill. If documentation supports that 2 of the 3 elements met a high level of medical decision-making, then TCM code 99496 would be appropriate to bill. Contact LVPG Compliance Education if you have any questions or would like more information on TCM services.